Let's work through a person's journey to highlight how genetics and genomics intersect with nursing practice across the care continuum. After moving to Toronto at age 31 for graduate school, Adrienne Rogers, identified as she, her, went to a family practice clinic for help with anxiety and GERD. She met with the nurse practitioner for an intake assessment where Adrienne was asked to provide a 3-generation family history. On her father's side of the family, an aunt was diagnosed with breast cancer at age 49. Her grandmother was diagnosed with breast cancer at age 57. And more recently a cousin was diagnosed with ovarian cancer at 42. Jeff offered to refer Adrienne to a clinical genetics program to discuss the role for genetic testing and to learn about her risk of developing breast or ovarian cancer based upon her family history. Adrienne had concerns about genetic testing and learning about the genetic test results and worried this may cause conflict within her family. Jeff addressed Adrienne's concerns and offered suggestions on how she could discuss genetic testing with her family members. Adrienne did undergo a multi-gene panel including 20 genes implicated in cases of hereditary breast and ovarian cancer. She was found to have a pathogenic variant in the ATM gene. Given Adrienne's genetic testing result, she was referred to a high-risk screening program at age 32, where she met with Ananya, the nurse navigator for the program. Ananya and Adrienne met frequently during the first year of the program for education about her risk of developing breast and ovarian cancer, cancer screening and risk reduction options, and to learn about the implications of her genetic test results for her relatives. Adrienne experienced significant distress after learning about her genetic information. Knowing she lived with a higher risk of developing cancer, she found it difficult to look forward to the future and made her second-guess her desire to have children out of fear of passing along her genetic variant to a child. Ananya met with Adrienne regularly to provide education and psychosocial support, and referred Adrienne to a peer-based program in the community to speak with other young adults who live with pathogenic genetic variants. Based upon her age and life stage, Adrienne decided to complete annual mammography and breast MRI, and said she would consider risk reduction surgery, prophylactic mastectomy or oophorectomy, when she and her partner made decisions around family planning. Unfortunately, at the age of 39, Adrienne had a suspicious finding identified in her right breast on annual breast imaging. She later underwent a biopsy, which confirmed that she had invasive mammary carcinoma. When she met with her oncology nurse, Gordana, to discuss her treatment plan, based upon her ATM variant. Gordana worked with her nurse educator to find resources to support her own understanding of this genetic test result, as well as educational resources she could share with Adrienne. Gordana also advocated for a team meeting with all members of Adrienne's care team to discuss how her genetic findings should influence the treatment plan.